So this question is, how do I interact with someone who has Alzheimer's? It's a really interesting question, and I think perhaps the best way to answer it is to think about what it might be like to have Alzheimer's. I think one of the best bits of guidance that I came across very early on, which I still really adhere to now, I got from a book called Contented Dementia, and all the details for it are in the video description below. The guidance is, imagine what it's like to have Alzheimer's yourself. So the first thing is to not ask direct questions. It's surprisingly hard to do that. If you imagine just coming up to somebody, the first thing you do is say, "Hi, how are you?" It's always a question. But if you have Alzheimer's disease, and I think this happens even in the earlier stages, but it happens increasingly as the disease progresses, is you don't always know. So if the question is, did you have trouble getting here? Sounds like a really kind of simple, innocuous question, but actually you might not remember how you got here. Well, how did you get here? Was it by car? Was it by bus? Was it by train? Did somebody bring you? Were you on your own? So if you know that you should know the answer to the question, but you don't know the answer to the question, then what can often happen is you kind of feel a bit embarrassed, maybe, perhaps embarrassed and then cross, certainly agitated. So it becomes a very emotional experience, and all you've done is said, "Hi, how are you? Have you had a difficult journey?" Or it could be something really, really straightforward. So you can see that even in a very simple situation, direct questioning can be tricky. So with my mum, the way I get around this is that I try to reduce the amount of direct questions that I ask, because sometimes you do have to ask them. And I try and find sort of more roundabout ways of getting the information that I want. So for example, if I'm chatting with her on the phone, and maybe we're coming towards the end of the call, and I'm thinking, I don't know whether she's eaten yet, and I don't want to say to her, "Have you had lunch? Have you had supper?" She won't know. So what I do is I might do something like, I'll say, "Oh gosh, we've been talking for ages. I'm feeling really hungry. I think you can probably hear my stomach rumbling from there." And then I'll just make a statement, which will be more like, "You're probably hungry as well." And what I've done by doing that is I haven't asked her a direct question, that's the first thing. I've also talked about the subject for long enough to let her sort of think about food and to consider whether or not she might be hungry. And by the time we've done those two things, she'll often say, "Actually, I am a bit peckish." And then I get the answer that I'm seeking, but it doesn't always work. And I think it can be really confusing if you're not used to being with somebody who has Alzheimer's. So I think one of the biggest problems is that sometimes the person can come up with the answer that's being asked of them. For example, if they're in a shop and they're being asked, "Do you have 20p, or do you have the right change?" Or again, it's something quite simple and they're not sure and they're struggling to find the words are not coming. In that situation, just be patient. Doesn't need anything more than time for them to collect themselves, find the words, and that situation will be resolved. So those are the two of the most important things. Then kind of in all of that, it's trying to remember to see the person, really, to see the person first and not the disease. And that way you just keep it simple, keep it straightforward, and keep it light. I think the more I find with my mum, the more I can keep things light and jokey and fun, the better, because then she's not anxious and I'm not always thinking about the disease, and she can see that in how I'm thinking about it and how I'm talking to her. I think it helps. I'm not sure, but I think it helps. So I'm going to dive deeper into that in other videos, but if you want to find out when that happens, then subscribe. If you have your own question, then just tweet your question to me, which is send a tweet to answers to ALZ. Okay, hope this has been helpful. Bye.